doctors, if they want to be successful, have to be impressive business people as well as impressive doctors, or it's not going to work.
Yeah. Well, and doctors don't go to school to be that. And
Right.
so this is why there's groups like us out there.
We were talking a little while ago about the value of somebody's doctor, and people don't brag about their poor doctor or their modest doctor. They want to go to a doctor that actually can impress them. They want to go to the best for their health. If I were to ask you what's a really good hospital, what name would you come up with?
I don't know. I'd probably think of the biggest hospital there was around. And
Like the Mayo Clinic?
Could be, yeah. To me, the consideration is the bigger the hospital system, the more I assume, the better they are.
Yeah, because they're around for a while, and they're doing well because that's why they're around for a while, because they're doing well.
Yeah.
And the same is true when people perceive doctors. They don't want a doctor. Like, could you imagine if somebody said, "Oh, go to my doctor. He's in this little crappy office in a basement, and it's a little cold in there, and there's not really windows, so it's dark. So bring a sweater, and he's going to have you put this orange cube on your head while you're sitting there." You're going to be like, "What? It really works. It really works." It'll never fly.
No.
People want to go to an impressive place, and doctors, if they want to be successful, have to be impressive business people as well as impressive doctors, or it's not going to work.
Yeah. Well, and doctors don't go to school to be that. And
Right.
so this is why there's groups like us out there that help teach doctors the business side of the business while they can be doctors and deliver what they do best.
Yeah.
Because we actually give them that part. It's kind of interesting because you're right about that in the sense that the public perception in medicine is if your doctor looks like they're financially doing well, right? And the office is in a beautiful location, or the office is clean and neat, like that perception is that their healthcare is delivered that way.
Yeah.
And when you get that public perception, right? And we're talking 90% of the population, because 10% of the population who go to chiropractors might like your used living room furniture in the waiting room. Like, it might make them comfy, but 90% of the population, what you reflect to the public is a reflection on what your service is like. Whether you like it or not, that is the scene. And so when you come in and you've got old tattered magazines from 4 years ago in your waiting room, that just shows you your technology that you use in your healthcare with the patient is 4 years old. Like, this is the perception that they have.
Yeah. Deepak, we're talking about the doctor's image, and is that part of the healing process? And a lot of people would say, well, that's just placebo effect. Well, let's look at placebo effect. Dr. Deepak Chopra from Harvard said, if you could be your own placebo effect, you would have the safest, most effective treatment. Mm-hmm. So he's saying is, it's the patient that's going to get themselves well, and they have to be in agreement with what the clinic and what the doctor is saying.
Yeah.
And if the clinic looks like crap, they're going to lose that credibility.
Yeah.
So you have to promote yourself in a way that they realize, well, other people must come here because they're doing well. This must work.
Yeah.
And that's going to not only be good for being able to get new patients on board, but also getting that patient that you start to believe that what you're doing is going to fix them and getting better.
Mm-hmm. Which all starts with perception.
Yeah.
And and this is where I say sometimes when I talk to doctors, I get you're not in it for the money. But if you actually want to help people, you have to have the perception that you yourself are helping yourself and doing well.
Yeah.
In order to help another person. So it's an interesting problem that they run into. It's like intention, counter intention, intention, counter intention.
Right.
And then they never do well. I don't want to be rich and I don't want any money, but I want to help a lot of people. Well, how do you help a lot of people if you don't have any money to help a lot of people? It's a losing game is what it is. Yeah.
Right.
So it's actually okay.
The busier you get, the more you need help, and you need money to pay for that help. I have never had an employee say, "Oh, I'll work for free." Mm-hmm. It's just like people don't do that. They have to feed themselves and their family as well.
Yeah,
so it's just exchange. And who should get, we're not in a socialist country, we're in a democratic republic, but that means you reward the people who do the better job.
Yeah, exactly.
And you should live in a nice house. If you're a doctor that gets your community well, you should live in a really, really nice house.
Yeah, 100%. Yeah, absolutely.